This is a patient with a 29-year-old patient that presents with 40 different tics. We are just starting him today. We have taken impressions for a mouthpiece, which we will deliver next week. We have just received his MRI report, which is totally negative for internal derangement, and he is only the second patient we've ever had with no internal derangement for Tourette's symptoms. Do you want to say something to the viewing audience?
I really don't know what I would say. I'm just really looking forward to this treatment, and hoping everything goes well.
Okay. Okay, we're just going to let the camera run for a few minutes while we show some of these tics that this young man is suffering from. We've given him some tongue blades, and we're very hopeful because 3 to 4 tongue blades greatly diminish his tics. And that will be the height at which we begin construction of his intraoral orthotic. We're going to have it made over the weekend. This is the last day of the week that we're going to work. We're going to have it made and presented to him next week. Okay. Let's?
Yeah.
Okay. Okay.
I still twitching a little bit,
But the urge is less.
Yeah.
It'll go away. Okay. We determined a day or two ago that by experimenting that with the patient putting the sticks in and out of his mouth while he was at home, that 3 or 4 sticks made his urges go away. He still twitched a little bit, but 4 sticks was decreased his urge. So this is him with 4 sticks just sitting here while we mix up the acrylic. Okay, is it on? Okay, here we have loaded up the occlusal surface of the appliance with soft acrylic, and we are going to take the sticks out of his mouth, open, and replace it with a soft acrylic. And just close on down. See, touch lightly. Okay. Open. Okay. And we had him close down to those sticks. Now, give me a scaler, or just sit here for a minute. Okay. Come on back. We are removing this from the mouth. This is what it looks like. Notice how motionless he is when his mouth is wide open. And we're going to flatten it down to where these 4 impressions or imprints are, where these 4 imprints are on each side. Okay? Okay. Okay, we are putting this in for the very first time right now. Right. Okay. Tap up and down, tell me if one side hits before the other.
Yeah.
Which one hits first?
Left.
Left side. It's always the left. No, we need it. Chop, chop. Tap, tap. You can see the left side hits much harder and sooner than the right side. And so we're just going to trim that down. Lift still high?
A little bit.
A little bit, but not as much as before, right? Chop, chop. Here you can see we're starting to get some contact on the right side, but the left side is still hitting harder. So we'll equalize both sides.
My jaws like that, they hit even. Like that, but when I bite down as normal, I'm still hitting the left first.
Okay. Yeah, we want it normal. But you're getting closer.
Yeah.
Chop, chop.
Tedious process, huh?
Excuse me?
Tedious process, huh?
Yeah, it is tedious, but spot on the money.
Yeah.
Okay. Now tell us when it's like that. What's it do for your urges?
Very minimized. I mean,
They're decreased.
yeah, like,
Can you put a number on it, a percentage, like out of 100?
probably at least 60%.
That's pretty.
Because, I mean, just a minute ago, I was really going crazy. And,
Well, 60% for 2 or 3 minutes is pretty good, don't you think?
I'd say.
yeah.
Make Mama happy? Maybe I should have charged your daddy more, huh? I bet he'd be willing to pay.
I might not have this right now if you charge him more.
Oh, yes, you would. Yes, you would. Well, it'll increase your urges, the percentage will increase as the days go by. And I want you to pay particular attention to how you sleep tonight and the next night. A lot of people report, like that other kid from Canada, that was the best night's sleep he ever had in his life. And he's a 15-and-a-half-year-old kid.
Yeah.
And that's the first thing we've noticed is sleep. I got it open, you notice I got these ledges here for your tongue. You keep your tip of your tongue up here like that. And that'll make you sleep better at night. Because it'll open up your throat and you'll breathe better. You get more oxygen. And if your mouth is dry, you know, if that bothers you, some people it bothers you, just keep a glass of water by your bedside. But if you sleep better, you know, it's a good trade-off.
Yeah. Definitely. Sometimes some nights I don't even sleep.
You don't get any sleep at all?
Some nights no.
Yeah.
It's twitch all through the night.
Well, you can't function, you can't grow, and you can't do anything if you can't sleep.
Yeah.
You know, sleep is the most important thing in the world as far as I'm concerned.
Me too.
tell the viewing audience how you feel. You've had this in your mouth now 5 minutes by the clock.
Well, as I guess planned, the urges are have dissipated. They're not as severe. Still getting an occasional urge to twitch, and those aren't even as prolonged as previous. So far, I definitely think it's working. As I said before, it's definitely doing what it's supposed to.
Put a
Control
number
the
on it.
urges. Yeah, like about 60%. Less urges, at least. I mean, as you probably saw in the videos before, that they were pretty bad, and now hardly. I mean, for me, it's hardly noticeable anymore.
Okay, this is the end of the delivery appointment. After 5 minutes, his urges are down 60%, which is typical. That's what we've noticed in most of these young adult males. And once the urges go away, then the actual motor movements go away shortly thereafter. So we're highly encouraged with what we've accomplished, which hasn't been accomplished for this young man before. So we're very hopeful that everything's going to be back to normal very shortly. Okay, let's see you in about 2 weeks.
Go ahead.
We delivered this gentleman's lower appliance 1 week ago, and he returned today to receive his upper appliance. We have put in his upper appliance a few minutes ago, and we have increased the height of his lower appliance. He is still having these attacks, as you see, but they appear to be of shorter duration than when he originally presented 2 weeks ago. Would you agree with that?
Yeah, I agree with that.
Okay. We'll dismiss him now and see him in 3 weeks' time to see how he's coming along with both appliances in. We have adjusted the upper appliance that we delivered today to the lower appliance and rebalanced everything out, so he's hitting evenly on both sides. This young man has now had his lower appliance and this young man has now had his appliances for a total of 3 weeks, and you can see the difference. And I want you to say something to the speaking audience and tell them what the improvement's been over the last 3 weeks.
Over the last 3 weeks, I've noticed a great deal of a benefit from these devices. At times, up to 80% difference in the reduction of the ticking from Tourette's. I mean, as you've probably seen in the last videos, you know, my head, my arms, legs are going crazy. At this point now, it's not the case. Occasionally, I do have, you know, tics, outbursts, but they're mainly limited to my neck. My arms and legs really don't twitch at all anymore. So I'm very grateful for this treatment. It's definitely done a lot for me.
Okay. Let's have Mom. This is this young boy's mother who's going to tell you the improvement in the last 3 weeks.
We have been so pleased and so blessed that Brian is seeing this kind of improvement. He can sit through a meal. He can read some now. He does not suffer from the headaches and shoulder aches that he used to. He can drive. I don't worry so much about him driving anymore, that he's going to have outbursts and run off the side of the road or something like that. I'm just very, very grateful for everything that Dr. Stack has been able to do for Brian, and I'm happy for Brian that his life is, since he was 5 years old and now he's 27, that things are looking very, very positive for him.
Excellent. Well, that's good.
Definitely.
That's good. Okay.